opportunity to contribute in this summit, and a pleasure to be here. I need that because my grandchildren want to prove that I'm in conference, I'm not on holiday. Thank you. Today, I'm presenting safe patient handling techniques. Does theory match practice? Moving and handling. Our aim of moving, handling, and instructing our pre-registered nurses safe moving and handling is to apply minimal effort by healthcare providers so that the patient suffers no discomfort or injury. Our main aim or goals of safe patient handling program is provide sufficient understanding and knowledge of manual handling regulations, the risk assessment involved and control measures available, reduce the incidence and severity of musculoskeletal injuries, decrease nursing turnover, reduce costs from these injuries, create a safer environment, and improve the quality of life for patients and residents. Encourage the reporting of incidents and injuries, create a culture of safety, and empower nurses to create safe working environment. Our program includes giving theory, 12 hours theory over 2 weeks, then a discussion, and then training, demonstrating, give them clinical practice in lab, and send them to hospitals to practice. What we're giving them, this is the input what we give. What's the lower back pain? What causes back pain? What's the lower back pain disorders? Starting from showing them the spine, structure of spine, what's normal disc, what's the degenerative disc, bulging disc, the difference between herniated disc and bulging disc, and disc degeneration, and the ostia. So we give them a kind of practice and a kind of case studies, theory and practice. So starting from causes of back pain, lifting of heavy objects, prolonged sitting, injuries, accident, quick movement, and other causes like muscle spasm, decreasing alignment, herniated disc, difference between small fracture, degenerative disc diseases, muscle strain, and curvature spine. Then we give them an input on prevalence and incidence of back pain. Back pain is the most common reason for filling workers' common claims. 80% of the adults who experience lower back pain. Most of the time, injuries to the lower back pain happens at work. The statistics show, do apologize, I have to go back. The statistics show that moving and handling, 37% of accidents happen during the injuries of back. 49%, the statistics show in Health and Safety UK, 49% people suffer from back pain. International statistics show 52% of nurses complain of chronic back pain with lifetime prevalence up to 80%. 38% reporting have occupational related back pain severe enough to require leave from work. 12% of nurses leaving the provision report back pain as a main contributory factor. 20% have reported changing to a different unit, position, or employment because of back pain. The UK National Health Service statistics showed 58,000 nurses have back injuries. 3,600 nurses lost to the NHS each year. 70 millions cost of nurses' absence, 50 millions cost of nurses' replacement. The risk factor for lower back pain is heavy manual lifting, repetitive movement, constant vibration, poor posture, continuous work, poor physical fitness, low back threshold, weak trunk musculature, smoking, stress, depression, pregnancy, arthritis, and obesity. We focus nurses, their posture and their position. Sitting long time on a unit and causing back pain. We focus on the regulation, which is avoid, whenever possible, avoiding a hazardous manual handling. We do the assessment. Assess if avoidance is not possible, making a suitable and sufficient assessment of hazard in the next step. Reduce risk by continuous risk assessment, training staff in safer handling techniques, introducing appropriate handling aids, and changing work patterns will help reduce the risk. Reviewing and evaluation of the assessment whenever change occurs. And then we talked about the ergonomics, how we use equipment to fit the job and help to reduce the incidence of back pain. We teach nurses they avoid lifting and controversial techniques. I'll go through, because we've done a research, and I think it's too many research to prove that controversial techniques should be avoided. One of the controversial techniques, I'll go through 10 or more than 10 techniques should be avoided for safe moving and handling. One of them, if you look at this, some nurses are still using this technique and it's being banned because no drag lift. This can damage the patient's shoulders and nurses' backs. The other one, a cradle, or we call it orthodox lift. The patient heads and necks are unsupported. The nurses are carrying the weight on their hands and wrists. On this Australian or shoulder lift, this can damage the patient's chest wall and nurses' backs. Through arm lift, this can damage the patient's arms and nurses' backs. This lift, 3-persons lift, the patient could fall, or if nurses stumble, uneven loads would be transferred. Front-assisted transfer, this could damage the nurse's neck, or either person could fall. So after we train nurses, giving them the theory and the practice, we've done a study on 3 levels of nurses, the 2nd year, 3rd year, and the 4th year. And the aim of the study was to survey patient moving and handling experience of pre-registered student nurses and assess episodes of self-reported back pain experience during their exposure to clinical practice. The reason why we did this study, we had experience 8 out of 25 nurses ended with back pain after practice, after we sent them to hospitals and clinics. We used the nurses, our participants were nurses, pre-registered nurses, 230 nurses. Response rate was good, 89%. We use a cross-sectional descriptive study. And if you can see here, number of student nurse experience episode of back pain during their clinical spectrum placement, ratio between two groups. If you look at the gender here, we see more female ended with back pain, more than male nurses. And if we look through the year of study, fourth year, 87.3% of nurses ended with back pain, and that will indicate that the long they stay on clinical practice with a bad technique, an unsafe technique, they ended with a back pain. Then we asked the question, have you ever been asked to physically lift, move a patient without equipment? And the answer was the correlation, or it showed significant test. Yes, 87% they ended with pain, and that was significantly correlated that at the clinical practice they never use equipment to help them to transfer patient. Was the equipment available? That's another question. 71.4 nurses end with back pain, no equipment at all at that placement. The site of musculoskeletal pain experienced by participant whilst working in clinical experience, percentage of participants who reported pain while the clinical practice as part of their nursing training was highly lower back, neck, and then shoulder. So the lower back was higher. Frequency of reported usage of unsafe technique for patient transfer used in clinical practice. Student nurses using draw sheet for position patient in bed. Used to drag patient with a draw sheet. They use through arm lift and drag lift. So still at the clinical practice, still the unsafe technique. Frequency of freezing considered by participants to be the main barriers to addressing safe patient handling in the hospital facilities they were exposed to were mainly lack of equipment. So the clinical practice, they're not considered using the ergonomic to help nurses to maneuver patients. So unsafe technique is still the main reason. Plus the attitude of nursing that use the old system and not prepared to listen to the trained nurses or the young nurses that had the correct technique, listen to them and allow them to practice. If we ask whose responsibility is it, reduction of musculoskeletal injuries lies in our hands. Where nurses, it's our responsibility to change your practice. The main strategic plan for nursing is nursing leadership, nursing education, continuous staff development, nursing services, provide equipments, provide facilities to help nurses, nursing regulation, review policies, regulation. That's the main strategic plan to change your practice. Our recommendation after completing this piece of work, although it is continuous study, that's the first stage of study, our recommendation, review organizational and educational policies and procedure, written safe patient handling policy, and no lift. Health care protocols on risk assessment and prevention of back pain. Make the right choice and standardize the risk assessment and assess whether all areas of risk are addressed within the care plan. Implement educational programs in the clinical areas for specialized training of safe moving and handling patient objects that are structured, organized, comprehensive, and directed at all levels of nurses, healthcare providers, and consider time for staff to attend in services. Review the equipment in place to ensure the product type has demonstrated effectiveness in reducing an individual risk. Collaboration of nurses in implementing a safe moving and handling training program in the clinical area. Regular monitoring and evaluation of the intervention. Provide adequate staffing level ratio to patient, and reward and recognition to nursing for achieving goal. Thank you very much. Thank you for listening. Thank you.
It's very important. So I have a problem with my back and the neck when I was young and to try a lift.
Oh, you have a problem with lifting, but the lift is banned. No lift. Thank you. Thank you. Thanks a lot.
Thank you.
Thanks a lot. Thank you.